Indiana Hospital has introduced recently a OCT gated angioplasty. So can you tell us something about OCT gated angioplasty?
Yeah, definitely. Indiana Hospital, Mangalore, our cardiology department is introduced this technology recently. Actually, this is a new technology in cardiology where you can do a complex angioplasty. I will tell you what is this OCT. OCT means optical coherence tomography. Say when somebody is having a problem, for example, somebody is having a problem in the urinary tract or in the ureter, then we introduce a scopy there. Then through the scopy, we will see what is happening in the ureter.
Okay.
Or somebody is having a problem in the stomach, we introduce a scope into the stomach and see what is happening in the stomach. Similarly, all these days we were doing angiogram where we will see only blood vessels, whether block is there or not, and how much is the block is there, whether a stent can be introduced or not. Here we passed a scope through the heart into the blood vessels of heart. So there is a camera, this will capture the image of that block, and then it will come in the screen. We can analyze what type of block it is, whether it is a cholesterol block, or it is a calcium block, or it is a fibrous block, or whether it is a serious block, or it is a mild block, or blood clot is there, whether it's a fresh clot, old clot, everything we can analyze. And by this technology, your angioplasty optimization, we call it as optimization. The best result of angioplasty can be done if you have an additional technology. You don't have to depend completely on angiogram. Angiogram we call it as a luminogram. You will see only the lumen. Here you see inside what exactly happening.
So one patient is going for a OCT gated angioplasty. What are the advantages one patient can expect other than this normal angioplasty?
See, all angioplasty patients need not go for OCT.
Okay.
There are patients who are having multiple blocks, who are having complex blocks, who are having blocks with a lot of calcium. These blocks, the angioplasty results are inferior to bypass surgery.
Okay.
So these patients, if you have an OCT machine, then we can do OCT guided angioplasty.
Okay.
That way, if you do, that result may be better than bypass surgery. So for the patient's point of view, if many patients who are undergoing bypass surgery, and if you go to a center where the OCT gated angioplasty is doing, they can avoid bypass surgery and they can go for angioplasty. Recently we have done many cases which was clearly referred for a bypass surgery, suppose left main bifurcation. This case we have converted it into OCT guided angioplasty.
So this is the first time getting introduced in Mangalore and also in Karnataka.
No, this is not first time in Mangalore, correct?
Okay.
And first time in Karnataka, correct. In private setup, only Apollo, Bangalore, and we are having this, and Belgaum. These three hospitals are having now. Recently introduced all the three, and other place I think they may introduce this technology also. Now you can go inside the stent and see. This is the stent. You can see the white things. As if I am going through a tunnel, I can see the stent inside. Whether it is positioned correctly or not, whether that is apposed. Stent, sometimes you can get a malapposition. This is stents. You can see the studs of the stents like a net. And if it is not apposed properly into the wall, there will be a gap between the stud and the wall. It can suddenly cause some thrombosis, and that can cause a heart attack in future, maybe suddenly after 2 months or 3 months. So with this technique, I can see the inside the vessel very clearly, as if I am going through a tunnel. With this technology, we can implant the stent very appropriately. Now you can see another patient, the block you can see. Here, this is before implanting the stent. You can see there is no much block here, and you can see this black portion is the blood going part. The yellow portion is so you can see the calcium. Now you see very narrow portion of the black part. It means there is a block. And also you can see that the yellow part, you can see a lot of geographical mismatch like thing. That is calcium, as well as some cholesterol crystals are there. And you can see now very tight. Now you can see this is very tight. It means a lot of clot is coming inside, very tight block. Initially we thought there are a lot of calcium, so now you can make out this is not the calcium, this is the clot. So if angiogram, you will make it as okay, it is a calcium, may not be able to do angioplasty, but here we can see it is full of clot. So it is a heart attack patient. So you can differentiate the block, what type of block it is. Is it a clot, or it is a calcium, or it is a cholesterol block, or any other block. According to that, your decision may change for different patients. Thank you very much.